I'm going to do a video about Icepick Freeman. This man was credited for doing over 2,000 lobotomies during his career. He began this in the 1920s and the 1930s. He was a neurologist, and he performed over 2,000 lobotomies in the course of his career. Now, he wanted to help people in the mental wards. You have to remember at this time, there was very little that could be done to help people with mental problems. They were kept in insane asylums in small rooms, and basically that's where they remained for the course of their life. They did not have the drugs to help the mental problems. They did not have the advanced therapists that we have now. They basically had thousands of people strapped in rooms, getting no help at all. So Dr. Freeman decided he would help. Now, the basic idea of lobotomy is that you want to separate two parts of the brain. You have frontal lobes, which control things like higher reasoning, planning, things like that. And then a little deeper inside your brain, you have structures called limbic systems. Now, these systems are involved in emotions. And the theory they had at that time is that these emotions were getting all revved up, and they were interfering with your normal brain functions. You were all revved up, no place to think. So originally, a Dr. Igas Moniz developed a lobotomy, which was a full-fledged brain operation. Had to have a hole in each side of the brain, and then a thin piece of metal was placed in there and then moved around to separate the frontal lobes from the limbic systems. Now, Dr. Freeman decided there was a much better way to do this, so he worked on a operation that used something as simple as ice picks. That's correct, ice picks. Now, he developed a way to do these lobotomies with these normal ice picks. They were called a transorbital lobotomy. He would go in to the orbit through the eye socket. He would slide the ice pick right up on the inside of the eye, which most of the time was done without anesthesia, sometimes with 3 electrical shocks prior to this. But he would slide these ice picks through the inside of the eye, and when he came upon the thin bone and back, he would take a little hammer and drive the ice pick into the brain. Once in the brain, he would start swishing the ice pick around to sever these connections. Now, this new procedure of his was much quicker than a full-fledged brain operation. Many times he could do up to 25 of these lobotomies in a single day. Sometimes he'd kind of show off and he'd even do 2 at once. Now, during the summer, he loved to relax and take road trips. He finally decided he would decide the road trips along with saving some people by doing lobotomies. So he would do some lobotomies, a little driving, do some lobotomies, and then drive a little more. Now, he would be able to perform these lobotomies on adults, teenagers, even children. If he saw someone who might in the future develop a mental disorder, well, he would decide he was going to help them and then prevent them from getting into an asylum, and he would go ahead and perform this lobotomy to save them from future brain disorders. Now, of course, these lobotomies did have their risks. There were different variations in different patients. Some cases, he did serious brain damage, and sometimes the patients actually died. Sometimes the patients ended up basically just sitting there drooling, unable to take care of themselves, very oblivious to everything around them. Now, for many of the patients, he referred to it as they just lost their sparkle. They just lost their sparkle. Now, eventually, the serious failures of this lobotomy caught up with him, and he was persuaded to cease and desist. There's many people had died. He happened to have nicked an artery in the brain. Thank goodness the therapy for the mentally challenged has come a long way. We now have excellent therapists, counseling, and the pharmaceuticals involved in the industry have come a long, long way and have helped many, many people. Hopefully, this will keep the Icepick in the drill